The hepatitis B vaccine. What is it and why is it so important? There are 4 main inactivated hepatitis B vaccines approved for use by the U.S. Food and Drug Administration, or the FDA. Angerix B, Heplisav B, Prehevbrio, and Recombivax HB. Hep B vaccines are used to prevent the disease hepatitis B, a viral infection of the liver that can lead to cirrhosis, liver failure, liver cancer in some people, and even death. This infection can range from a very mild illness with few or no symptoms to a serious condition requiring hospitalization. Some people are able to fight the infection and clear the virus. For others, the infection remains and is chronic or lifelong. Since 1991, all medically stable infants with a birth weight of at least 2,000 grams in the U.S. are recommended to receive the first dose of hepatitis B vaccine within 24 hours of birth. The additional 2 doses are given at 1 month and 6 months of age. Combination vaccines, such as the pentavalent and the hexavalent vaccines, include protection against 5 or 6 more diseases, including hepatitis B. The Hep B vaccine series can then be completed with a pentavalent or hexavalent vaccine with the recommended schedule. For most people, the hepatitis vaccine is safe and effective. About 90% of people who receive 3 vaccine doses are protected against hepatitis B for over 30 years. The CDC's Advisory Committee on Immunization Practices recommends the hepatitis B vaccine for the following 4 groups: all babies just starting after birth, children and adolescents under 19 years old, adults ages 19 through 59 who have not previously completed vaccination, and adults ages 60 and over with a high risk of contracting HBV. The hepatitis B vaccine should be given intramuscularly. For an infant receiving the vaccine, it should be given in the vastus lateralis, or upper thigh. For an adult receiving the vaccine, it should be given in the deltoid muscle, or upper arm. This is the dosages for the vaccines, and you would go according to which vaccine you have received. If a patient has a severe allergic reaction, anaphylaxis, after a previous dose or to a vaccine component like yeast, they should avoid this vaccine. And anyone with hypersensitivity to yeast should take caution with the hepatitis B vaccine because it is made using yeast. Common side effects of this vaccine include soreness and redness at the injection site, headache, fever, weakness, and a rapid heartbeat. Less common side effects include aches or pains in the joints, difficulty with breathing or swallowing, hives, itching, and especially in the hands or feet. The patient should notify the provider if the symptoms become worse. Again, hepatitis B vaccines are made using yeast, and individuals that are allergic to yeast should take precautions when getting the vaccine. Other vaccines may interact with this one and should be carefully examined before administering them together. Some products that may interact with this vaccine include drugs that weaken the immune system like corticosteroids such as prednisone and chemotherapy. Other vaccines may be given at the same time as hepatitis B vaccine, but should be given with separate syringes and at different injection sites. Most hepatitis B vaccines are free with insurance or through government plans like Medicare. However, if you are paying out of pocket, the price can range from $50 to $150. Hep B can be very serious. Most people with a recent infection may feel sick for a few weeks to several months. Some people get over this illness, and for other people, the viral infection remains active in their bodies for the rest of their life. Although people with lifelong hepatitis B don't usually have symptoms, the virus causes liver damage over time and could lead to liver cancer. Although there is no cure, we can do our best to prevent the spread of it by getting the vaccine. To learn more, go to the Center for Disease Control and Prevention link in the bottom left corner.